I'm Bill Munley. I'm the Vice President for Orthopedics and Professional Services here at Secours St. Francis Health System. Well, I actually received a call from Dr. O'Boyle, who was very excited about the new concept of a geriatric fracture center.
The care of hip fractures at this hospital was similar to just about every hospital in the country. It was a low prioritized case, typically done on the add-on list in the middle of the night, done by whoever happened to be on call. These are patients that many of them had been living at home independently, and the hip fracture may be the event that now prevents them from going back to the home that they've lived in for the last 60 years.
If my own 80-year-old mom, who lives here in Greenville, broke her hip in 2005 and went through that process and died 4 months later, I would have thought everything that could have been done was done, and that was the normal process.
We just came to realize that it wasn't enough just to take care of their hip fracture, that we had to put together really a team that was going to understand all the other aspects that go into caring for these patients, caring for their families, and getting them through this event.
There was really no risk for us to do this. This was just a change of protocol, and we figured we would change things like the length of stay and maybe volume and save some money, but the biggest factor was the change in the patients' lives. We really found that this made a big difference in outcomes, and even if we broke even on it, it was the right thing to do for the patients.
The program started here at St. Francis on January 1st, 2007, and my role was really created soon after that. We realized the need for one key central person to have all aspects of the patient's best interest at heart, and kind of a key person to be a liaison between all of the team members here involved in their care. We found that that was an essential step in the success of the program, because they had to connect the dots, so to speak, and cross every T, dot every I, to make sure that every step was being followed in the process.
Like that. So it was just a pattern of working together in such a way that it was amazing to watch.
Before the program started back in 2007, typically we start physical therapy on post-op day 3. Now we start at day of surgery.
They've got it. They boost you up, get some drive into you. I like that.
On the day of evaluation, we just get the patient out of the bed into the chair.
There's a recliner. It's up or down. Also, you can recline the backrest for comfort.
On the following sessions, we do exercises with the patient, walk them in the hall. We do have a physical therapy gym, but typically our treatments are one-on-one with the patients in their room or in the hallway.
It's been a real easy experience. Everybody has been just wonderful to me. It was just like staying in a motel room. It was wonderful. I told my daughter I was going to ask for one of those rooms when I come back for my hip replacement.
We look at how we cared for those patients in 2005 compared to now. The patients get through the emergency room quicker, they get to surgery quicker, they have a much less chance of postoperative delirium, their mortality rate's been cut in half, their return to independent living has gone from 20% up to 80%, and all this is done in a more efficient manner, so they literally spend less time in the hospital. This should be the standard of care for a hip fracture in this country now.
I would recommend St. Francis by all means, for they have the best, and you can't beat them.